This is Brennan Marilla. I am the Chief Commercial and Operating Officer for OSSIO, and I am joined today by Dr. Lance Silverman, who's an orthopedic surgeon who specializes in foot and ankle reconstruction, and he has a very successful solo private practice in Edina, Minnesota. Welcome, Dr. Silverman.
Good morning, Brennan.
Good to see you. I've wanted to start off by asking you how this is affecting you and your community, and how are you managing the business of your practice right now?
Well, Minnesota, like all the rest of the United States, has been greatly affected by this. This has changed the way that we as a society are interacting and how we as physicians are permitted to help take care of our patients. With the exception of that which is deemed urgent or emergent, we can't do what we've been trained to do. And that's really affected a lot of the ways we can even relate to our patients and help take care of our community.
How about the business of your practice? What types of things are you having to do to ensure that the practice can thrive beyond the current time that we're in?
My initial thought when I went into this is, okay, this will be a short-term event with little effects, and I will just roll with the punches, get my PPP loan, and get back to work. And that has really migrated in the last week and a half to, no, this is going to push us 10 years into the future in a matter of weeks. We are going from a mostly orthopedic surgeon, face-to-face interaction, hands-on to patient, to a rapid shift into medical telehealth. And practices that don't make that switch are going to be significantly affected in the future for any number of reasons.
Maybe you could share some other ways that you think this will change the way you practice moving forward.
There's an expression that I believe in. When you let the camel put its nose inside the tent, the whole camel's getting inside the tent. We opened up the concept of delivering healthcare through telemedicine,
right?
Delivering our non-surgical care or our pre-surgical workup care through telemedicine. That has been opened up, and we've been forced to do that. You can't roll that back. You can't say it was good enough during a peacetime emergency, and it's not good enough for the people during a non-peacetime emergency to do that. And there are people who are going to say, why can't you take care of me the way you took care of my last problem, right? I came and I told you my big toe hurt, and I showed you a picture, and you made the diagnosis by my history and by a picture on the phone, which most of us can make about 85 to 95% of diagnoses by listening to what the patient had said. In medical school, we were taught, when in doubt, listen to the patient. Not look at, not touch, but listen. And listening is the key to making the majority of our diagnoses. There's an expression about orthopedic surgeons. We are more likely to interrupt somebody within 27 seconds of their first few words on their chief complaint. Why? Because we already know what the diagnosis is, because it is relatively simple in most circumstances to figure out diagnoses. If you listen to people, we can make that diagnosis. Telehealth gives us even more clues. I am changing the way I am planning on taking care of people going forward based on this event.
Any other tips and tricks around making a diagnosis remotely, or reaching patients remotely, or engaging with your patients when you can't be in front of them?
Well, it is going to take a change in some orthopedic surgeons' abilities to relate to people. If you're someone who's a little bit more shy, you're going to have to learn how to handle camera-to-camera talking. As far as making diagnoses, we are going to see, and I'm sure I'll release one soon, we're going to see people putting out videos, how to diagnose things by telehealth. You've already seen this on ViewMedi, where ViewMedi has how you do a shoulder exam on a patient. but learning how to do exams and learning, there'll be techniques coming out on the internet. Keep your eyes open, keep looking if you're having trouble coming up with your own. There's an expression in orthopedics: be flexible in your thinking and rigid in your fixation. So we want to be flexible about how we think about examining people, how we think about interacting with them on computer, on our cell phones. But we want to be rigid in what we need to make our next set of diagnoses. I believe that we need to improve our relationships as community. Solo practitioners are given a huge lift here. This is, I have great solid relationships with radiology facilities, and I plan to use them. And can you imagine the convenience to a patient who comes and meets me for the first time, like you and I are talking on the screen, and I say, okay, I have a pretty good idea of what you have, but I need a couple of things done. On your free time, go to this radiology facility because I can see those images at any time. Because this problem is going to need some non-surgical management to address, most likely. I'd like you to go get this insert from this company. I'd like you to go get a physical therapy home program and a inpatient and outpatient program to work on. And I'm going to send those to my office staff. And you're sitting there, quick little typing on another screen, or because if you're using your phone on your screen, you type away and tell your office staff. It can get documented into your electronic record, and you can see more people with less of the staff it took. There's some numbers in orthopedics that we've thrown about for years and how many people it takes to support doctors and orthopedic surgeons in general. In general, it takes between 4 to 6 staff to support a foot and ankle orthopedic surgeon. The increased number of staff, you can diminish that from your initial intakes. What's even better? I don't like to say I don't like to see non-surgical patients, but I would love to have had abilities to screen non-surgical people and take care of them, which is easier for them.
Yeah, right.
You come to an orthopedic surgeon, you should be thinking, that person's talking to me about what I'm going to need surgically. When you come to see them virtually, we can do all of that non-surgical care beforehand. If you look at what are non-surgical options for treatments of lots of different diseases, we often have patients who come to see us who've had less than ideal non-surgical care, but they've been living with that less than ideal non-surgical thing for 6 months or 9 months or 2 years or 5 years. Having the conversation with someone that says, hey, you know, I want you to do a little more non-surgical. Do you know how hard that is after this person has made their appointment, filled out their paperwork, taken out time off of work? That's 4 hours of their time. These people in the world, 4 hours is a lot of time, and time is money. But to take that first visit and make it as efficient as a telehealth visit can be. And I can say to those people, I know you've been working for this for 2 years already, but I want you to do this one thing while you wait to come in to see me for a surgical opinion. I want to see if you can eliminate some of these other problems that you have, like your tight calf muscle. I want to see, can you go do a physical therapy stretching protocol so that I can say, you need this and this done, but you don't need your calf muscle lengthened because you did it with physical therapy. And it can help you to see people and build trust even before they walk in the door.
What practical tips or lessons or advice do you have for your peers that we haven't talked about?
Well, we talked about getting into telemedicine. That's going to open up the whole world for the small time provider and the large time providers. We're all going to have an even shot now at people. It's going to change the way we can give patients care who live hundreds of miles away. Getting your staff educated and ready to go for this. If you need time, because some people learn at different speeds, and some people are going to be able to handle this, and some people are going to have more challenges. Get on the Doximity beta app. That Doximity app, that app is awesome. Having people connect with your staff a few minutes before their appointment helps iron out a lot of problems.
Yeah.
Expecting somebody to be there and ready, the kind of the tricks we're using in my office is I have my office staff call, take some of the intake stuff they normally would be doing. Any change in your medical history, any change in your surgical history. Okay, expect to receive contact from Dr. Silverman on whichever platform we've all agreed to work, whether it's Zoom, or you like Google Hangouts, or you like this Doximity option for physicians. That's how you work that.
How can OSSIO make a difference? How can our technology make a difference when the both right now and when the world gets back to kind of semi-normal?
You know that I'm prejudiced towards this product because I love its concepts. I love its building upon nature concept. OSSIO's biointegration, right, eliminates the need for hardware removal without decreasing, but actually increasing the rate of healing. Mm-hmm. The number of backlog of cases from people with simple hardware removals would have dropped if OSSIO's product line can get out there and start helping, right? The internal structure of the OSSIO material is nature-based rather than being based on metallic, right? Artificial-based. And its natural basis is something that we need to be striving to be going forward to. I'm a big fan of that concept of striving for a more natural approach.
Good, that was great. I have one last question.
Mm-hmm.
What have you learned about yourself during this stay-at-home period so far?
Well, that I'm as susceptible to psychosomatic stress problems as anybody else. If I allow the stress to get to me, it paralyzes you. But if you say, how can I utilize this stress? How can I take control of it? It's opened up my mind to greater possibilities of what can be done. It comes back to that Eastern philosophy. It isn't bad, it isn't good, it just is.